All right. I know people are still jumping on, but I'm going to get started here. My name is John Randall. I'm a regional director at GoldenCare USA. If you haven't been to our website or given us a call, please do so. Our website is goldencareagent.com. We have a lot of great tools that we are allowed to give to our agents and let them use. We got a great back office support team. So go to our website, goldencareagent.com, or dial 888-842-7799 and ask for marketing support or regional director. And we can definitely answer any questions for you. But I feel very blessed today to have Stephen Moses with us. Steve Moses is the president of the Center for Long-Term Care. He was president of the Center for Long-Term Care Financing. He was the director of research for Long-Term Care, Inc. He was a senior analyst for the Inspector General of the U.S. Department of Health and Human Services. He was a Health and Human Services developmental management intern when he started out, and he started his career basically, he went to a Peace Corps volunteer in Venezuela. He is currently recognized as an expert and innovator in the field of long-term care. GoldenCare has been working with Steve for many, many years. We've always enjoyed having him on to do our industry updates. We traveled with him a little bit with the Silver Bullet tour that he gave. Don't remember the exact year of that, Steve.
2008.
2008. Yep, we were one of the big sponsors, and we also met him at a few different places. I met him in Ohio a couple times when he was doing that Silver Bullet tour for long-term care. But with no further ado, I'm going to pass it over to Steve, and we're all very excited to hear what you have to say, Steve, and thank you very much for getting on today.
Well, happy to do it, John, and thank you for that nice introduction. I've got about 35 minutes of content, and I think that'll give us plenty of time for questions and answers. So let me start by saying good afternoon, everyone. I want to thank GoldenCare for inviting me and you for listening to what I have to say. There is no more honorable profession than helping people prepare for excellent long-term care if and when they need it. So I'm proud to be part of that enterprise with you. Now, I know what's on your minds. GoldenCare Management told me. There's the Secure Act, the Washington Cares Program, and a whole bunch of other states with their own grand plans to fix long-term care. There's also the day-to-day challenge of fashioning insurance solutions for individuals and families of vastly different health and financial situations. So let's get those current hot topics out of the way first, as of course they're staring you in the face each and every day. You're out there in the foxholes fighting the good fight for better long-term care at the ground level every day. You have to cope with whatever your prospects, the media, or the government throws at you day in and day out. Now, here's my take. The long-term care insurance industry has been enormously creative and resilient in the face of numerous obstacles put in its way by government policies that discourage responsible long-term care planning. When government made traditional policies hard to sell, the industry designed hybrid policies. When long-term policies are too expensive, short-term policies fit the bill in many cases. When someone is ineligible medically, maybe a medically underwritten annuity will fit the bill. There is something you can do and use to help virtually any prospect. The point is that with creativity and ingenuity, the long-term care insurance industry has given you tools to work around the obstacles government and consumer denial have placed in your way. In my opinion, the Secure Act won't have a great effect. In fact, most of the articles I read about it didn't even mention the long-term care provisions. But the Secure Act will help by bringing up the subject of long-term care. More people may become concerned enough to invite you to explain the benefits of early long-term care planning to them. That's some rare help coming from the government. Likewise, the Washington Cares Fund is big news. Analysts and advocates have pushed for a big new social insurance program like Social Security or Medicare for long-term care for decades. They've failed miserably. So now several states, including big ones like California and New York, are planning to take on the project of socializing long-term care for themselves. So far, Washington State is furthest along. The big news there is this irony. WA-CARES, as they call it, set out to trap everyone in a mandatory payroll-funded long-term care social insurance program, but they ended up unleashing the biggest demand for private long-term care insurance in the history of the product. Here's what the 2022 Milliman long-term care insurance survey had to say. Quote, we estimate that 140,000 to 150,000 people purchased standalone long-term care insurance coverage in 2021, more than triple the 2020 numbers. Outside of Washington, the number of new insureds dropped 9.4% based on the insurers that reported sales, unquote. Now, what is the message we should take from this amazing outcome? Certainly not that we need to trap more Americans on new, big, bankrupt, payroll-funded social insurance plans. We already have too many of those, including Social Security and Medicare on the verge of insolvency. Rather, the message to receive is that the key to getting people to plan early for long-term care and save, invest, or insure for the risk is to move that risk forward in their lives so they confront it while they are still young, healthy, and affluent enough to do something about it. Can we do that in a more benign way than the route WA-CARES is taking and those other states are leaning toward? I think so. And that's exactly what I'm working on now for the Paragon Health Institute, a big new institute oriented to finding ways to save on healthcare costs of the government. We've already made a key step in the right direction. One of the reasons that most analysts and advocates end up proposing big new government programs is that they never stop to ask how long-term care in the USA got so messed up in the first place. Here are the key questions. Why do most people end up in nursing homes when they'd rather age in place at home? Why do most people rely on public welfare, that is to say, Medicaid, when they need expensive care? Why do families and friends have to provide $500 billion worth of so-called free care when their loved ones could have bought LTCi? Why are private financing sources like insurance and home equity very nearly untapped when they could fund quality long-term care for all Americans if utilized? Now, those are four key questions, and I answered all four of them in a paper titled Long-Term Care, the Problem, published last October by the Paragon Health Institute. I encourage you to go read it, and you can find it on the center's website, www.centerltc.com, under articles, speeches, and reports. The answer, in a nutshell, to all those questions is that government caused all of the problems by making Medicaid available, even to middle class and affluent people, long after they should have planned for it and too late for them to do anything else. It really isn't complicated once you understand what's going on. The underlying problem is that most people don't worry about long-term care until they need it. Then they turn to Medicaid and qualify much more easily than is commonly understood. Why that is still true, in spite of decades of telling people they need long-term care insurance or they'll lose their life savings, is the real thing that matters, and that I'll spend most of our time today explaining. So hold that insight in the back of your mind, and let's go back to essentials. Put our thinking caps on and see where we end up. I'm going to take you out of your sales and marketing foxholes for a while, up to the 30,000-foot level of national public policy, because if we can fix long-term care financing policy, your jobs will become much easier and far more profitable. So here we go. People are living longer, dying slower, and often in need of substantial assistance with normal activities of daily living. That's a basic fact that the country must deal with politically and economically. Providing and paying for that assistance that older Americans are going to need is a big problem. My paper for Paragon described it in this way. Medicaid pays for most long-term care, but it pays too little to ensure care access and high quality. It supports too few professional caregivers, causing excessive financial and emotional stress for unpaid family caregivers. It caused institutional bias or nursing home bias by paying only for nursing homes for decades. And it still shorts home and community-based services for the elderly. It impeded markets for private long-term care financing, such as insurance and home equity conversion. In fact, Medicaid created a moral hazard by covering catastrophic care late in life without enforcing strict financial limits. It diverted people who should, could, and would have planned for long-term care otherwise. It shunted them into public welfare instead. So, the fundamental problem with long-term care is that the availability of Medicaid to pay if and when catastrophically expensive care becomes needed late in life has enabled the public to ignore long-term care risk and cost, avoid the responsibility to save, invest, or insure for it, and shift the responsibility to a welfare program if necessary. That, in a nutshell, is the problem we need to solve. Now, the challenge before us, therefore, is how to focus the public's attention on long-term care earlier and to get them to prepare for its risk and costs before it's too late to prepare privately. The traditional approach to do that has been to threaten. For decades, government warned people, if you don't plan for long-term care, you could lose your life savings to paying its cost. Well, no one believed it. Government didn't enforce it, so the public ignored long-term care until they needed it and ended up on Medicaid. The most popular alternative to this failed strategy today is to force everyone into new compulsory social insurance program for long-term care on the model of Medicare and Social Security. That'll make them deal with long-term care, these social engineers figure. But so far, the advocates of this approach have gained no political traction at the national level. Lately, social insurance advocates have tried the same thing at the state level. Many states are toying with the idea, but only Washington has moved forward with implementing legislation. In fact, effective July 1st of 2023, the Evergreen state plans to impose a 0.58% payroll tax intended to fund a lifetime benefit of $36,500 for taxpayers who vest after 10 years. Never mind the inadequacy of that benefit, the economic drag of the tax on the state economy as recession looms, and the fact that voters rejected the program at the ballot box twice. What matters is that WA Cares, as the plan is called, added an escape hatch to counteract its unpopularity. Buy private long-term care insurance by November 1st, 2021, and you could become exempt from the payroll tax. Nearly 500,000 people took that option, about 13% of Washington's workforce. This created a huge demand for private long-term care insurance, tripled national sales of the product compared to the previous year, and overwhelmed the industry, which soon withdrew the product. Now, here's the point. No one worried about long-term care as long as they could wait until they needed it and then rely on Medicaid. But when Washington state forced citizens to confront LTC now, not later, large numbers acted quickly and did the responsible thing. My point is not only that they bought the insurance product, but that they took the only action the state allowed them to escape the payroll tax. So here's our challenge, and I ask for your ideas and suggestions to help us meet it. I'm writing the paper on how to solve this problem and eagerly receive ideas from anyone. How can we get people to worry about and plan for long-term care while they are still young, healthy, and affluent enough to prepare for it, but without threatening either one, impoverishment, which never was and never will be enforced, nor two, a one-size-fits-all compulsory social insurance program? Okay, that's a big ask, but maybe not as big as we might have thought. Recent research suggests that the long-term care financing challenge is somewhat more manageable than formerly believed. Half those turning 65 will need no paid long-term care. Average costs for those who do need LTC will be about $138,000. For which, setting aside the present discounted value of $70,000 could cover. Not so daunting, maybe, after all. Furthermore, Johnson and Wang, quote, found that 74% could fund at least 2 years of a moderate amount of paid home care if they liquidated all of their assets. And 58% could fund at least 2 years of extensive amount of paid home care, unquote. The problem is getting people to liquidate the wealth they already have, which current Medicaid rules obviate, that is to say, remove the need to do. How might we take advantage of what we've learned? That is, we've learned that people confronted with the necessity to plan for long-term care will act responsibly. There's a lot more financial wherewithal in the public's possession to handle the likely LTC costs than we realized, and those costs are substantially lower than we formerly believed. Recognizing there is no easy solution and seeking your suggestions, here's one idea. We could formally establish a personal responsibility no later than age 50 for long-term care planning equal to each individual's likely contribution to the risk pool. Let private companies like Underwriters Laboratories, for example, compute amounts each person needs to set aside in order to cover his or her personal long-term care responsibility. Now, preparing for average risk and cost, instead of insuring against the small risk of catastrophic loss, would be much more affordable. Still, younger people coping with car and house payments, children's education funds, etc., folks in the prime of life would still be hard pressed. Where might they find the funds to pay their LTC responsibility, averaging, remember, only $70,000 at age 65, but probably much less at age 50 when we want them to work on this challenge? Here's some possibilities. Well, long-term care insurance in much smaller premium and coverage amounts could be more within their reach than it is now. Certainly, your job would be much easier. You might sell smaller policies, but you'd sell a whole bunch more of them. Number two, government might offer a new tax-deferred savings plan designed especially for long-term care, or it could allow withdrawal from existing retirement plans, forgiving not only the penalty for early withdrawal, but exempting the taxes on funds used to meet the LTC planning requirement. Home equity conversion, or setting aside and targeting a portion of home equity, could put to use the $11 trillion, much more probably, of home equity held by seniors that now goes untapped for long-term care. Likewise, Americans have $20 trillion tied up in life insurance, much of which could go to help a new long-term care planning standard. Last but not least, or only, financial institutions could offer a new product. I've called it the defined reverse estate annuity mortgage. That would allow people short of cash liquidity to earmark a portion of their future estate toward long-term care. It would be similar to Medicaid's estate recovery requirement, but more enforceable. It would have to have a lien or other formal legal obligation recorded in public records. Otherwise, it wouldn't be any more successful than Medicaid estate recovery. Now, obviously, there is more than enough money and resources in the American economy to fund a much freer long-term care market if Medicaid didn't crowd it out. But this plan has at least three major problems, and these are the ones I'm struggling with right now. One, how to create the long-term care planning responsibility, how to enforce it and what to do about those who will not or cannot comply. At a minimum, government will need to acknowledge that the current system of long-term care financing is broken and unsustainable. Parenthetically, most analysts already acknowledge that Medicaid cannot continue as the primary long-term care payer. The public will need to take more responsibility for funding long-term care. So, how do we get them to do that? Well, for starters, how about we eliminate these features of Medicaid long-term care benefits so that people can't ignore long-term care risk and costs, wait to see if they ever need expensive care, and if they do, transfer the risk and cost to taxpayers via Medicaid. Here are the most egregious errors in current public policy that need to be eliminated. Number one, purchase of exempt assets. Now, this is probably the biggest and most expensive method of artificially self-impoverishing oneself to qualify for Medicaid. Famously, Medicaid requires that personal assets be spent down to a very low level, usually $2,000, before eligibility is granted. Take a drink here. But the program does not require that such assets be expended for health or long-term care needs. You can spend them on anything. This loophole allows Medicaid applicants to protect unlimited wealth by purchasing things or services that are not included among Medicaid's countable resources. Such items that aren't countable include home equity, up to, can you believe it, over $1 million in some states effective January 1st of this year. And without any dollar limit, you can have one automobile, prepaid burial plans, one business, including the capital and cash flow, term life insurance, household goods and personal belongings, even retirement accounts, individual retirement accounts in many cases. Medicaid planners routinely advise clients to maximize this path to eligibility. In fact, they have long lists of non-countable assets that they urge people to purchase with their countable wealth. So here's a recommendation. Eliminate the exempt asset loophole by requiring spend down of resources be for health or long-term care expenditures. Implement immediately this plan for people under age 65, except in cases of chronic disability or early onset dementia. If people are stricken early, then let's treat them like we do people who are already over age 65 and let them operate under the current rules. But for everyone else, let's send the message that this little gimmick is gone. Number two, home equity exemption. Current Medicaid law exempts between $688,000 and $1,033,000 of home equity. That it depends on the state. As home equity is most seniors' biggest asset, protecting this wealth from long-term care liability has the effect of discouraging responsible and early long-term care planning. Financial tools and methods, such as reverse mortgages and home equity loans, enable individuals and families to access otherwise illiquid home equity for the purpose of funding home-based long-term care in the private market. As the legitimate purpose of Medicaid is to ensure access to quality long-term care for the underprivileged, the program should not shelter such large amounts of home equity from eligibility consideration on behalf of middle class and affluent applicants. So here's another recommendation. Eliminate the Medicaid home equity exemption with enough advance warning that it incentivizes early long-term care planning without unduly affecting people already too old to prepare. Number 3, the Medicaid Asset Protection Trust, or MAPT. Quote, a Medicaid Asset Protection Trust is exactly as it sounds, a trust designed to protect assets from being counted for Medicaid eligibility, unquote. Took that right off the internet. There are hundreds of ads that promote these things. Putting wealth, including real property, into an MAPT 5 years ahead of application for Medicaid long-term care benefits removes unlimited amounts from eligibility consideration or spend down requirements. So, recommendation, prohibit the use of MAPTs. This is not rocket science. Number 4, Medicaid compliant annuities. Quote, a Medicaid compliant annuity is a single premium immediate annuity, SPIA, that contains zero cash value and provides income to the owner. Properly structured, this annuity functions as a spend down tool that eliminates excess countable assets, allowing the nursing home resident to become eligible for Medicaid benefits, unquote. There is no limit on how much wealth can be sheltered with a Medicaid compliant annuity. Examples from a congressional study that I cited in that paper, Long-Term Care, the Problem, I mentioned earlier, included $400,000 in Rhode Island and $900,000 in Virginia. And once again, ads for Medicaid compliant annuities are all over the internet. If you think your prospects don't know these things I'm telling you about, you're, well, naive. So, recommendation, eliminate Medicaid compliant annuities as a means to qualify for Medicaid while preserving wealth. And now, number 5, the 5-year asset transfer look back under Medicaid. Assets transferred for the purpose of qualifying for Medicaid within 5 years of application are considered in determining eligibility according to a formula that delays qualification. But assets transferred more than 5 years before applying are completely ignored. They're not even asked about, okay? Because the average period of time from diagnosis to death in dementia cases is 5 years. Families that transfer assets at early signs of mental deterioration can entirely avoid Medicaid spend down requirements. Because real property ownership and transfers are publicly recorded, easy to check, and represent the largest portion of seniors' wealth, the look back period to discourage their transfer for purposes of Medicaid qualification should be much longer. It is unlikely that so many people would become Medicaid eligible and hence join the group of most expensive recipients who are dually eligible for Medicaid and Medicare, a huge problem for planners right now. If they were under notice of asset transfer limits 20 years in advance instead of 5, they'd be much more likely to avoid the eventual need for both for Medicaid and Medicare. So, recommendation, expand the Medicaid asset transfer look back period from 5 to 20 years. Implement these changes now for everyone currently 50 years of age or younger, while allowing older folks to qualify under current eligibility rules. Very soon, the public will have an epiphany similar to what happened in Washington State when people suddenly had to confront long-term care or pay a new tax for the remainder of their work lives. Long-term care insurance policies of all kinds, including traditional, hybrid, Short-term policies will fly off the shelves. LTCi producers will find themselves in financial clover instead of the existing briar patch. If a new and stronger need to plan immediately for long-term care is the bad news for consumers, the good news is that planning for long-term care will not be the hopelessly difficult problem it has been before. You only need to cover the average risk you bring to the LTC risk pool, not the catastrophic possibility of the worst happening. If people shirk the responsibility to cover their average LTC risk, well, what happens then? There must be some consequence. We're trying to avoid the alternative of forcing everyone into a big new fiscally unsustainable government entitlement program. Instead of trapping everyone like that, we only enforce the personal responsibility for long-term care planning on those who do not meet it voluntarily. But when people realize those methods of qualifying for Medicaid without spending down that have been on the law books since the start of Medicaid no longer apply, few will fail to take action. That was the lesson from WACARES. Let people be free to take responsibility for LTC planning voluntarily and hold them accountable only if they don't, but do it now, not later with unenforceable threats. That builds on the traditional American values of freedom and personal responsibility that 5 decades of presidents and Congresses tried unsuccessfully to enforce by threatening but never requiring long-term care spend down. If people are only responsible for their average LTC risk, what happens with the 15.2% of people who will incur $250,000 of LTC cost? Medicaid or some new safety net program will need to continue to carry that responsibility, but we'll be able to do so more realistically after the average LTC risk and cost has been picked up by the private sector, uplifting the access and quality of long-term care services throughout the country. I'm not so naive as to think this program can be achieved through public policy advocacy now or even really soon. But I do think something very like it will evolve in time by default as the United States economy goes into recession. Carrying costs on staggering government debt become unsustainable, and the big social insurance programs we already have fail. So why not have a substitute ready? That's what we're trying to do. I thank you for your attention, and I'd be glad to take questions.
Most of the people are on mute and won't be able to ask questions. So
Okay,
we will get the questions if they type them in on their
on the chat,
you know,
right?
chat line. And then if we need to, Steve, I'll reach back out to you if I don't know the answers to them. But I wanted to thank you very much. It was a lot of great material there, and I'm sure everybody appreciated it. We got a lot of good things going here at GoldenCare. Be on the lookout for some exciting new short-term care products. We've been in the long-term care market forever. We know it's getting a little harder to get because of underwriting, so health and wealth are big reasons to make sure we still protect people. There's some pretty good short-term care products out there that are getting pretty powerful. So we want to make sure we can take care of all of our clients that come to us looking for this. But I want to thank everybody again for getting on today. Feel free to ask some questions, and we will answer those for you. But everybody have a wonderful afternoon. Enjoy the rest of the week. And thank you again, Steve. It's always a pleasure.
Oh, you're
Take
very
care.
welcome. John, thank you for having me. Bye-bye.
Check out our website, goldencareagent.com, or give us a call at 800-842-7799.